Hi, I'm Eric Durack and welcome to MedHealth Fitness Wellness Commentary. This segment is on the high cost of healthcare and how the wellness industry may actually help control these costs. Recently, I had lunch with a longtime friend and colleague who ran clinical exercise programs for diabetics for years. Our discussion at one point focused on healthcare. Now, as a self-employed person, he berated the point that he had to pay over $22,000 a year, even before stepping into a doctor's office. In our discussion, he blamed that high cost of healthcare on the 30 million Americans who now have insurance through ACA or Obamacare. I told him I thought that healthcare was a little bit more having to do with greed than it does improving basic healthcare coverage. So here are some points. Number one, Medicare has tens of billions of dollars of fraud each year, which includes double insurance billing, fraud with durable medical equipment, and huge increases in a lot of medical fees. Number two, pharmaceuticals represent the biggest single expense to taxpayers, like the cost of drugs, insulin, EpiPens. They've gone up fourfold, tenfold, even 100-fold in certain instances. This level of greed isn't bad enough. The federal government is not even allowed to negotiate for lower drug prices for our nation's elderly. So many who live close to the border get them in Canada. Every other American area of commerce, those who buy in bulk get discounts, but not with prescription drugs. Number three, medical procedures. Since 1 out of 3 heart transplants are unnecessary and every hospital in America has to perform a specific number of hip replacements, stents, dermatology procedures, and colonoscopies in order to pay for their overhead, there are more and more procedures that are done simply that should not be performed. I guess that's the high price we have to pay for having our hospitals look more like hotels than actual hospitals. I told my friend that we should be looking at healthcare as a way to help others who can't afford it, especially with out of pocket, as opposed to looking at it as a commodity. And that's really what this discussion is about today. In July of 2018, a New York Times article discussed whether poor people have a right to have healthcare insurance. The statement in and of itself is both preposterous and offensive and would pretty much be discounted as nonsense by many people in the U.S., like my friend, but so many people believe it to be true. Since LBJ passed the Medicare Act into law over 50 years ago, the U.S., now over 70 million people, use Medicare as their lifeline for health insurance and a way to cost for employer-based health plans. But things like COBRA, self-insurance, and HMO, all of these things have climbed out of sight in the past 20 years because those who work in health insurance see it only as a commodity, something that needs to be paid for, and handsomely, so they can be on the top of the pecking order in terms of the healthcare space. This year, a small group of Kentuckians sued the state insurance fund because they believed that just because their income was below a certain amount, they couldn't get the basic Medicare-type insurance plans at an affordable price. Essentially, they were priced out of the market because health insurance is a commodity that needs to be paid for, and handsomely. Their lawsuit argued that insisting that people work a certain number of hours every month in order to receive Medicare benefits, like other requirements the state was planning to demand, is actually illegal because it runs counter to Medicare's purpose, which is to ensure that low-income people actually have access to health care. The lawsuit also contended that such requirements would imperil plaintiffs' health by depriving them of the only medical insurance they could actually afford. The new rules, which would have stripped recipients from their benefits if they failed to meet this monthly hours of work, the quotas and the other restrictive standards that were in there, were simply oblivious to the realities of low-wage living in Kentucky, and most of America in general. As the judge ruled in their favor, they did set a precedent. Now, other states that want to implement the same type of standards, like working a specific number of hours to be eligible, well, they're now holding their collective breaths to see how they would be seen from the standpoint of the citizens of that state who are actually poor. Also, in reading a report from Georgetown University relating to Mississippi's medical restrictions, it seems clear that lawmakers in a number of states see low-income restrictions as yet another means that they can save money on the backs of the poorest people of the population of those states. And much of this comes down to the obvious contraindication of health care. Is it a right or is it a commodity? What is it? Most health insurance and hospital agencies would still argue today that it's a commodity. Hospitals cost money to run. Insurance policies cost money to operate. However, as an outsider who's been looking into healthcare for over 3 decades, my perception is that the industry is fraught with both corruption and animosity. Corruption in that cancer treatments are paid for as clinical trials, with many of these treatments failing to improve both the length and the quality of life in many cancer patients. From an insurance standpoint, almost anyone who's had to argue with an insurance agent about the cost of any procedure can say that sometimes it's a scam and usually an irritant to argue for the cost of services that are in part of an employer-based benefit. However, for every 1% that companies can pull from the super bill, that's thousands of dollars that they will save on their bottom line, multiplied by thousands of claims a week. In the age of Trump, many Americans, what they consider to be values, have really come into question. Things like racism, gender bias, sexism, and lying are all coming into the mainstream regarding areas of government and corporate policies. Even the final paragraph of that New York Times article can be called into question regarding how people perceive the context of the words. Quote, "Our country's deepest values are reflected in how it treats its most vulnerable citizens. So as officials consider the future of Medicaid, they must ask themselves, is this how America is going to be?" Unquote. The premise of Obamacare was to ensure that Americans make certain that they have a specific access to health care services. Since Obamacare went into place, more than 30 million Americans do now have access to health care. Is this good? Well, yeah. I mean, they do get filtered into certain types of medical care. They don't get integrative services, many of which cost much less than traditional medical services, but they're also many times not even reimbursed. So the dilemma is that people want access and they make it affordable, but they're usually steered in the direction of drugs and surgery. So the cycle of medical care continues to repeat itself. Most types of chronic conditions can be improved dramatically with changes in diet, regular moderate exercise, and some type of integrative medicine, such as chiropractic care, massage therapy, homeopathy, relaxation, stretching, movement, etc. The continual issues that these types of therapies are not detailed to patients, even though they may be indicated as a primary type of therapy for a particular chronic condition. Well, it seems that America will be a country that continues to put corporate profits ahead of the welfare of its poorest citizens, regarding healthcare specifically. In fact, we will continue to build our dysfunctional system, comparing it to socialized medicine in other countries, when they should be comparing it to the nonprofit system of hospitals in the United States from the 1940s until the 1980s. According to author and radio political commentator Thom Hartmann, who I consider to be one of the country's top minds in terms of history and politics, many other subjects as well, the U.S. healthcare system was mainly nonprofit, as was Blue Cross and Blue Shield for the first few decades of their existence. The reasoning behind nonprofit was that most lawmakers wanted doctors to make decisions in the best interest of their patients, not the hospitals or corporations. Now, the U.S. is the only industrialized nation of the top 36 that believes healthcare is a commodity. Based on the greed of Republican politicians like Ronald Reagan, the Bush family, and even Democrat Bill Clinton, who all passed laws privatizing hospitals and making insurance for profit. Here are some statistics about the travesty that is the current healthcare system in the U.S. We rank 27th in overall health of our citizens. We rank 25th in life expectancy. We rank 175th in infant mortality. 25% of bankruptcies are due to healthcare costs, and a whopping 35% of all cancer patients file for bankruptcy due to the high cost of cancer treatments. Hospitals and healthcare systems also ration care. This is one of the best ways to increase profits. Of course, many who don't get care either die or their health situation gets worse. Thom Hartmann suggests a single-payer format may help solve many of these problems of our current healthcare situation. Here's my solution. We need to look at exercise and wellness as one of the primary elements of healthcare, of healing, and of healthcare management, and mostly cost savings. In the past 50 years of procedures of drugs, vaccines, and diagnostics, they've done little to enhance the wellness, improve productivity, and lower overall healthcare costs. However, during that time, health club programs for medical patients, integrative healthcare clinics, and a vast array of research has shown that wellness, exercise, complementary procedures, and stress management all have an impact on improving employee productivity, costing the system much less money than traditional care, and they've done so with very little cost to the taxpayers. Medicare will reimburse the cost of chiropractic and some acupuncture. Many health plans now give reward points for health club memberships and total steps walked on your iPhone. But now it's time for major health plans to do business with medical fitness and develop an outcomes-based change management process to allow persons newly diagnosed with a medical condition to take advantage of a wellness program, to get all smokers involved with smoking cessation programs, and to allow them to quit smoking through their work. It's time to have fitness programs in all elder care facilities and to have reciprocity between some of the 31,000 health clubs and studios in the United States and other organizations like the YMCA to use their pools, their strength training equipment, and their aerobic machines, all of which would go a long way to enhance physical strength, balance, and memory of most seniors while saving a lot of money. Part of this falls on the shoulders of health and fitness, who have for 3 or 4 decades now wanted to become a part of healthcare. Well, part of the responsibility is also on the shoulders of health organizations, who should actually be looking to health clubs and medical fitness centers to enhance their bottom lines by creating unique relationships with these types of businesses. Together, we can create a healthier workplace, healthier aging, but also stop the bleeding and cost spiraling that will certainly take down our nation's healthcare system at all levels. Our goal is to create these relationships within the next decade and allow our technology to track the health of those who use these services. Wellness has the ability to take the worst of times and create the best of times with a consorted use by a lot of people. I'm Eric Durek for MedHealthFit Commentary, and thanks for watching. We hope to see you on MedHealthFit TV through YouTube and right here on TV Santa Barbara.